Well, hello and welcome to our segment on healthcare and expanding healthcare here in the state. My name is Meda DeWitt, and I'm running for governor in the 2026 midterm elections. I am Alaska Native, and I live in Anchorage, Alaska, on Dena'ina Ethniana, with my partner and our 8 children total. 5 are still at home, 3 are out adulting, and that gives us a lot of context in understanding what our young adults are facing in this world.
I am Chris Steer. I am running with Meda DeWitt as her lieutenant governor. I have 5 of my own children, and we're very grateful to be able to use Indian Health Services here in Anchorage, especially with the ANMC. But not everybody has that, and that's one of the things I realized when I moved back to Alaska after my service in the Navy, which covered my whole family, including my wife. My wife isn't native, and when we were looking at healthcare just for her, it was going to be $2,500 a month, which you
Wow.
know, and then so I just gotten out of the military, not even a week out, and I went to the Air Force, and I said, "Okay, Air Force, what can we do?" Because there's no way I was going to be able to afford that.
That's wild. And so you were able to cover her while you were at the Air Force.
Right.
And so for us here at the house, of course, as being an Alaska Native person, I also get to use the Alaska Native Tribal Health Consortium and the Alaska Native Medical Center, so the tribal health system here in Alaska. But with my work, which I'm no longer a full-time employee, but I have had health insurance as an employee for a long time, which we still used our health insurance on top of those services to get further care because not everything is covered and not everything is covered to the fullest extent. I
Or
also,
their services might be overloaded, and the wait might be extensive.
and my partner, Chris Bailey, he has veterans benefits, so he can use the VA. And then his children are also in the back. We have a blended family for his and for mine. So we are also blessed to be able to be covered in multiple ways and get our needs met that way. But I really feel for a lot of our working adults who are still under a poverty line who may not have services available to them. They might aren't, covered by healthcare for their work, and they can't afford to get into that ACA marketplace. There's
Yeah.
people who went from affordable to being told that they now have to pay $1,000 or $2,000 for their medical insurance. And when we're looking at this across the state, we're actually looking at expanding Medicaid for our working peoples. One of the very easy things that we can do, especially since we're talking about children, is we have about 14% of our children who qualify for denied kid care who do not receive denied kid care. Because there's a cost sharing between the state and the federal government, if you do not enroll the people who qualify, then you get fined. So we're spending millions of dollars to keep people out of denied kid care, children out of receiving services. And then we have millions of dollars in fines for keeping said children out of receiving services. And so between those two costs, we can actually provide denied kid care to all of our kids. We could use the permanent fund enrollment system to enroll children into the program, set it as a second payer here in the state, and save millions of dollars while providing services to our kids.
Just to reiterate that, we would spend less money if we just auto-enrolled all Alaskan children than if we tried to gatekeep and pay the penalties for not getting everyone in and pay the resources for vetting all the families.
Part of the reason why our healthcare is so expensive is also that we do not have enough housing for healthcare workers. We have divested in our universities, and so we're not actually putting out as many healthcare workers here in the state. Also, we have contracted out for workers to come into the state, and so that actually is wildly more expensive than having employees who live here in the state. And we also are seeing that we do not have pensions available for our public servants. So our Public health nurses don't have a pension, or police officers, firefighters, and that actually needs to be directly addressed.
You want to take care of our healthcare workers?
What? Oh
What a,
my gosh, and
what
our
a novel
policemen and
idea.
firefighters, holy.
Yeah. Hmm.
I do. And it's going to save us money. They don't qualify for Social Security because they're supposed to have pensions, and in states they have pensions, and Social Security is a federal plan. And so as public servants, they don't qualify for Social Security. And so if they work here in the state throughout their lifetime, what they're looking at is destitution as elders. And so, of course, they're not going to want to be here. We have a beautiful state with a beautiful future ahead of us. We just have to treat it like we love this place. Care is more affordable. It costs over $85,000 a year to have a person on Medicaid who has chronic issues. And why are we saying that on Medicaid? Because if you have chronic illnesses, you're probably not going to be in the workforce. You're probably going to have to end up on disability with Medicaid services. And so that cost of Medicaid is going to be over $85,000 a year for somebody who has chronic illnesses. And again, that's just an average. Whereas preventative medicine and maintenance on Medicaid would cost about $4,500 a year. We want to make sure that we're looking at the line items in the budget in a way that makes not only makes sense, but saves dollars. And that's something that we haven't seen. We've just had austerity cutting numbers to make them fit. There wasn't the consideration of what do those dollars mean? What do those numbers mean? And if you're cutting certain dollars, then it's actually going to end up costing you more money in the long run.
It is a theme of this campaign that prevention is, cheaper than crisis. Like you maintain your vehicle and then you don't have a catastrophic failure down the line. We're seeing the same thing in our healthcare. $4,500 of preventative care a year for an average person versus you said 80,000,
Over 85,000, yeah,
eighty-five
for
thousand
chronic
dollars a
illness.
year for a typical person with a chronic illness, who is again then their productivity is greatly diminished. So we have less productivity in our society, less money going into the system. It's a whole breakdown for the illusion of saving money. The idea of cutting or cutting spending is financial responsibility, but it is the most irresponsible thing we could be doing when it comes to cutting healthcare for people.
And so if we increase some spending in certain areas, we actually decrease the overall cost of the system, now and in the long run. If you want to dive in deeper on a specific topic, please message us at questions@MedaForAlaska.com or put it in the comments and we will record later and get to as many as we possibly can. So thank you.
Thank you.